The coronavirus pandemic has affected our lives, our economy, our health, and has spread to all parts of the world. The rapid spread of new variants offers clues as to how SARS-CoV-2 is adapting and how the pandemic may play out over the next several months. WHO has said that the highly mutated Omicron variant of COVID-19 could change the course of the pandemic. Due to the previous lockdown and work-from-home culture, people's lifestyles have severely been disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthy lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the epidemic of diabetes and heart disease. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. If you have any questions you would like to ask them, send them to us via WhatsApp to the number +91 9167 666 941. That is the number for you to send us in your questions. Do please send us your name and location as well. We have with us today Dr. S. Vadivel Murugan, MD, former HOD, Department of Medicine, Madurai, Medical College, Madurai, former Dean, Kanyakumari, Government Medical College, presently visiting Professor of Medicine, Velamal Medical College, Consultant Physician and Diabetologist, Vada Malyan Hospital, Madurai. And we have with us Dr. Shahid Merchant, DM Cardiology, MD Medicine, DNB Cardiology, FSCAI Interventional Cardiologist, Leelavati Hospital, Mumbai. Thank you so much, doctors, for joining us today. I would like to start with you first, Dr. Murugan. Recent studies have shown that the Omicron variant has undergone significant biological changes, leading to easier and faster spreading of the infection. It has also been established to have changed the way it infects cells, thankfully leading to less severe infections. What could be the consequences of this kind of mutation?
The recent mutation, that is Omicron, it has got a faster spread. It spreads very fast than the previous one. More people are infected with this variant. And another important aspect is it is less severe. Even symptoms-wise, they have only blocked nose or headache, dry cough, and body pain. Even fever is less severe. So people may neglect this. And even the complications which arise out of this infection is, compared to the previous one, it is less severe because they do not require any hospitalization or even ventilation. But people who have comorbid conditions are affected more with this virus. People with asthma, pre-existing lung diseases, uncontrolled diabetes, cancer survivors, they may be affected in a very dangerous way. So those people have to be very careful. So others have to maintain the social distancing, and not only that, the vaccination, 2 doses of vaccine is a must for everybody. There is another important message I want to convey. All the people must get vaccinated with 2 doses.
Dr. Merchant, our next question comes from a viewer who has written to us on WhatsApp. Before I ask the question, let me remind our viewers that you can write in your questions for our experts. Do send us your question via WhatsApp on the number on your screens, and also please send in your name and location with the question. Doctor, the question is, now some scientists are suggesting that the Omicron variant might help defend against Delta. Is that true? What are your thoughts on that?
See, the Omicron variant had started in South Africa, and then they had done a very small study which showed that those who were infected with Omicron were protected with future Delta. Now, this is a very small study. There is hardly any data on that, and none of us as scientific people believe that those who have suffered from Omicron in the recent pandemic are also protected from Delta in the future. So really, if you ask me, we need a proper laboratory study to document that those who are infected with Omicron will be protected with Delta virus in the future. So really, if you ask me, I have no answer to this. And until I give you some scientific data and a study to prove that this is correct.
Dr. Murugan, how many times should a person with type 1 diabetes check blood sugar in a day? And is it necessary for every person with diabetes to check his or her sugar levels daily?
Type 1 diabetes, all of them will be taking insulin. They take insulin every day before every meal. So they have to test their blood sugars at least twice in a week. Speaking ideally, they must have a sugar checked at least 5 times, one in the fasting state. Then after every meal, they have to test. And before going to bed, they must test it again. But that may be very inconvenient and cumbersome. We recommend at least twice in a week, fasting as well as after food, twice in a week. And people who are not taking insulin, people who are taking tablets, most of the type 2 diabetes, they will be taking tablets. They can have their sugars checked once in a month, fasting stage as well as in the postprandial stage. And an average blood sugar every 3 months. So these are the recommendations that we make to the patients of type 2 diabetes. So type 1 diabetes, at least twice in a week, they must check their plasma glucose, the fasting as well as after the food. That way we can adjust the insulin dosages for them.
Dr. Merchant, what is heart failure? Is it the same as a heart attack? And what are some of the pre-existing conditions that may increase the risk of a heart failure?
Heart attack and heart failure are two different things. A heart attack is when you get an acute chest pain and there is a clotting in the coronary artery. So there is an acute blockage of the coronary artery with no blood going to the heart. And this will result in damage to the heart muscle. And on the ECG, that is a simple test that we do, we find something called ST segment elevation. And our treatment is different from that of heart failure. Here we give a thrombolytic therapy like a tenecteplase or a streptokinase, or we directly take patient to the cath lab. We stabilize the patient, do an angiogram, and if there is a clot in the coronary artery, then we suck out the thrombus, give some intracoronary medicines, and maybe we may put a stent in these patients. Now this is as far as the diagnosis by ECG, echocardiography, and the treatment is concerned of a heart attack. Heart failure is a more chronic problem, and it occurs because the heart muscle has become weak and the pumping action of the heart is low. Now, what do you mean by pumping action? We call it the ejection fraction. So in a normal person, the ejection fraction is 55 to 60%. But if a person comes and tells me, Doc, when I walk, I become breathless. When I walk uphill, I become very breathless. What is the cause of this? And we do an echocardiography and we find that their heart pumping is low. Many times these patients of heart failure cannot even lie down at the sleeping time, and they will need 2 or 3 pillows, and they have to sit up sometimes 2 to 3 hours in the night because of the acute breathlessness which they face. So heart failure is a condition which is maybe due to ischemic heart disease, due to a chronic blockage in a coronary artery with less blood going to the heart and the heart muscle becoming weak. But it can also be due to a valve disease, like say somebody has a stenosis of the aortic valve, which is the main valve of the heart, or the mitral valve, which is blocked or which is leaking, producing a dilatation of the heart chamber and resulting in heart failure. And this will result in increase in also the lung pressures, which we call as pulmonary hypertension. Now, in these COVID times, we have been very confused. Many a times when patients come with breathlessness, whether it's a COVID which has infiltrated into the lungs, producing pneumonia and consolidation, or is it a heart failure? We know it is not a heart attack, but we also know that COVID causes a heart attack because COVID is a procoagulant condition which produces thrombosis of the coronary arteries, and that would be responsible for a heart attack during COVID times.
So on that note, we're going to be taking a really short break. We'll be right back. Welcome back. You're watching Beat Diabetes Myths versus Facts. I want to ask you something, Dr. Murugan. Previously, it is known that there are only 2 types of diabetes, but now we know that there are many. Tell us, what is the difference between type 1 diabetes and MODY diabetes?
MODY is, if you expand MODY, it is maturity onset diabetes in the young. Maturity onset diabetes in the young. Usually it develops at the age of 25 years. Normally type 2 diabetes develops at the age of 35 in Indians. When you talk about the differences between type 1 and MODY, type 1, there is a total insulin deficiency. They do not have any insulin secretion. They have to be under insulin treatment. Whereas MODY, that is maturity onset diabetes, they can take tablets. They need not take insulin. There is a major difference. Number two, the maturity onset diabetes, they have a family history. The grandfather, father, like that, they may have a family history. Whereas type 1, there need not be any family history. Third thing is, type 1 patients will be very lean, emaciated. MODY people will be normal weight or obese. These are three major differences. MODY people can get the diabetes under control with tablets.
Dr. Merchant, is heart failure a normal consequence of getting old? Can it occur in young adults too? And how can we diagnose it in the early stage?
The heart failure can occur both in the old and in the young. So in the old people, when there is a blockage in a coronary artery with less blood going to the heart, that would result in the weakening of the heart muscle and they develop heart failure. The younger people can also develop heart failure, and that could be because of inflammation of the heart muscle. It could also be because of an acute blockage in a coronary artery with a clot. It can occur because of a valvular heart disease. Like if they have a rheumatic heart disease resulting in mitral stenosis and leakage of the valve, that can result in heart failure. Young women post-pregnancy can develop a cardiomyopathy with the muscle of the heart which becomes weak, and they may result in heart failure. So heart failure is something which can occur in a young baby. It can occur in a child, young people, middle-aged people, and old people. And the etiology will vary right from an infant who may have a congenital heart disease responsible for heart failure to a very elderly person whose heart muscle has become weak due to blockage in a coronary artery, due to diabetes, due to hypertension, due to aortic valve stenosis. All this may be responsible for heart failure.
Dr. Murugan, people with diabetes who neglect their health because of fatigue and other symptoms put themselves at greater risk of developing complications. Can diabetes cause a person to be tired and sleepy after eating?
So the fatigue in diabetic patients, we have nearly 95% of the patients are type 2 diabetes. That is, the diabetes develops in the adult age. So these people, they feel fatigued because the sugars are not under control. Because sugar, as you know, it is an energy source for the body. If it is wasted in the urine, they will feel very tired. That is the major cause of tiredness. And if they have high lipids, that is fat, we call them lipids, the various types of lipids. One is called triglyceride. So triglycerides, they increase in the blood after a meal. Immediately after taking a fatty meal, there will be increase in the triglycerides. So the triglycerides, they have a tendency for the patient to sleep. That we call it as postprandial. That is, after food, they feel sleepy. They have a high triglyceride value. They may feel sleepy after taking a food, taking a meal, especially a meal which is rich in fat. Whereas the fatigue is a very common problem with diabetic individuals. So they do not exercise properly, their muscle bulk is not good, they may feel very tired, and their sugars are not controlled. So the bottom line is you must control the blood sugars correctly. That will not cause fatigue.
Dr. Merchant, tell us, what can be done if a person is diagnosed with heart failure? Can heart failure be cured? For how many years does a person survive after diagnosis of heart failure?
Yes, there is a treatment available for heart failure. So we start right with the medicines which we give for heart failure. So there's something called diuretics, there's something called beta blockers, mineralocorticoid receptor antagonists, and now we have a medicine called angiotensin receptor neprilysin inhibitor. Now a combination of these medicines would definitely help to control the symptoms of heart failure in patients. We also have a diet, which we give, which we call as a heart failure diet to patients, so that if they follow the instructions on the do's and don'ts on that particular food, but the basic in that is to reduce salt in the diet, and they have to maintain their intake and their output. So their fluid intake has to be around a liter, and their urine output has to be about 1.5 liter. So if they are negative by 500 ml, they will not have fluid accumulation in their lungs, and they will not feel breathless when they walk. So this is by and large the treatment of heart failure, which we follow in close to 80 to 85% of patients. And then there are new devices now, which are called cardiac resynchronization device, where we put a lead in the right atrium, right ventricle, and left ventricle, which is spaced through a coronary sinus to improve the cardiac index. Then there are devices called the left ventricular assist devices. And then there is open heart surgery, like a heart transplant can be done for heart failure patients. Yes, the life of heart failure patients, if it is the stage 4 disease, then 25 to 30% of people may not make it at the end of 1 year. But if we follow their proper medication, we have a particular program which we called as a heart failure program, both in my hospital and in the clinic. And we guide our patients, and I have patients surviving even more than 10 years with heart failure with low ejection fraction. I'm one of the fortunate ones who have a big survival of my patients, because we really educate them not only on their medications and the newer technologies, but on basic things like their water intake and their urine output and their food habits.
Dr. Murugan, if a person has some of the risk factors for diabetes, how often should he or she be tested to find out if he or she does have it or not?
So the risk factors, when we talk about the risk factors in Indian context, it is a phenotype. Being an Indian itself is a risk factor for diabetes. So we recommend them to check the blood sugars at the age of 35. Then the family history. The parents, they have a history of diabetes, and sedentary lifestyle. They do not exercise properly. These people will have a tendency to develop diabetes. These are called the risk factors. Answering to your question, people who have a risk factors, they must check the blood glucose at least every year. That is the recommendation by the American Diabetic Association. At least every year they must check. And if the blood sugar is in the fasting stage, if it is more than 100, but it is less than 125, we call it as pre-diabetes. The same way, after 2 hours after taking food, blood sugar is more than 140, but less than 199, it is pre-diabetes. So these people, they have to test the blood sugars every year. That is the recommendation. If it is beyond 200, we call it as diabetes. So the recommendation is every year they must check the blood glucose. And HbA1c, there is another test which is called HbA1c. That is an average blood sugar for the past 3 months. That is another thing. There should be less than 6 if they want to be in the normal range. They have beyond that, they must check the HbA1c also every year.
Dr. Merchant, after this whole conversation, we do understand that exercise is a really important part of the management of any chronic lifestyle disorder. But people or patients with heart disease are confused about the exercise regime they should really follow. Which exercises are safe for people with heart disease?
Very true. The regular exercise that we recommend to patients is that at least we first make them do a 6-minute walk test. Now, in the 6 minutes walk test, we monitor their oxygen saturation, their pulse rate, and their blood pressure and their symptoms. And then we tell them to do it at home. With 6 minutes, they can go up to 10 minutes to 15 minutes to even half an hour, a moderate pace exercise. Yes, what is not recommended for them is to carry heavy weights or go to the gym and do the treadmill, because these all things has to be done under medical supervision. Like they cannot carry dumbbells to build up their muscles. So anaerobic exercise is out for them. Yoga is good for them. A light exercise like a yoga or meditation is good for them. And a regular moderate pace walk of how much they can tolerate. We give them an exercise protocol depending on their 6 minutes walk test.
Thank you so much, Dr. Murugan and Dr. Merchant, for joining us today and sharing your expertise. That's all that we have today on this very special show. News continues on NDTV on the other side. Thanks so much for watching.